What's up, guys? So I wanted to talk to you a little bit today about coaching. As physios, osteopaths, chiropractors and PTs, a large part of our job involves coaching our clients and patients how to move and how to exercise correctly. However, where I see a lot of clinicians and practitioners fall down is through their communication skills. While a physio might get really excited about the ability of their patient to calf raise or deadlift heavier loads to manage that, that niggly Achilles pain, if the patient then fails to recognize the relevance or the carryover between that increase in load and the pain that they're getting or their issue that they're getting, they ultimately will lose interest in their rehab, become disengaged, and then ultimately we have failed them as a clinician. What I'm going to go through here now is a real world example of something that I see quite regularly in clinic, and I guess how I use my communication skills to effectively communicate the relevance of exercises to my patients on a daily basis. Enjoy. So let's take the classic example of back pain when a patient has bent forward to pick something up off the floor and suffered an acute bout of symptoms in their lumbar spine or their lower back. As you can see in the video, the patient is practicing what we call a reaching lunge exercise, which is a single leg hip hinge that loads the posterior chain and helps develop lumbopelvic stability. However, when I'm initially coaching the patient on this particular exercise, they mightn't necessarily care, or it mightn't just be as relevant to them that the development of that posterior chain strength. So I might liken the particular movement to that bending forward movement or motion that originally triggered the injury in the first place, and give the reason for practicing it in this instance, in this safe environment, is to reduce the risk of re-injury more long term. So in that case, it makes it more meaningful for the patient. Once they're comfortable with the movement and that initial fear has reduced, we can then begin to add load and vary the exercises as you can see in the video. This will then help to develop that strength and lumbopelvic stability that we know can help. This is just one example of many examples that we can use of how we can use our communication skills when coaching to achieve better overall results. Give them a shot and see how you go.